Good afternoon, everyone. Thank you for joining us for this track. I'm very excited to give this talk and to hear the other two talks. My name is Tomás León. I'm a PhD student here at UC Berkeley in environmental health sciences. Today I'll be talking about the impact of the natural, built, and spiritual environments on human health, so the interaction between our environments and between our health. And so, first off, to make sure we're all on the same page, we have to ask the question, what is health? Now, normally the default is to think of health as just our physical well-being, but if we look at the WHO World Health Organization definition, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So again, here we are encompassing not just physical health, but mental health and social health as well. And in doing so, again, being healthy does not mean merely just being not sick, it means beyond that a state of well-being. And so when I'm looking at these three types of environments I'm talking about today, the natural, built, and the spiritual, I'm juxtaposing that with these three kinds of health: physical, mental, and social. So to start off, I'll talk about the natural environment, which is, again, probably the first thing that comes to mind when I use the word environment. It's the outdoors, we're talking about water, we're talking about the air, we're talking about soil and food. In terms of health, again, coming to mind might be environmental pathogens, might be bacteria and viruses. Also, we're talking about natural disasters in California. This is on our mind with earthquakes, with wildfires, with drought. And then, of course, when we think about climate change, it tends to encompass all of this thing as effects on the climate are going to push changes in water quality, air quality, again, on every aspect of the natural environment. And so to use some examples, if you've been keeping up with the news, Ebola has been in the news a lot lately. There's been a lot of talk about the situation in Africa, could this spread? And so the issue with Ebola as an outbreak is intimately tied with the natural environment because of fruit bat habitat, because of disease vectors, and when I say vectors, I mean organisms and other means of transmitting diseases. Ebola, in this case, has been very specific to a certain part of Africa. And again, the natural constraints of the environment dictate where the outbreak can spread. Now, at the same time, in addition to the natural environment, we know that the built environment, which includes infrastructure, plays into how the disease can spread because of access to medical facilities. And we also know that the spiritual environment plays in because then we start thinking about how people practice burial practices, which is going to affect transmission of the disease. Another instance of natural environment deals with my research. I study a class of parasites called liver flukes, which are 2 out of the 3 living organisms known to be carcinogenic, cause a very fatal form of liver cancer, about 95% fatality. So when you develop this cancer, it's bad business. And so I'm in the research area of trying to reduce the disease burden associated with this parasite. Now, it has a bit of a complex life cycle involving snails, water, fish, and humans and other mammalian hosts. And so my research has looked at how do we modify and change these variables in the environment. How do we affect the snails through which it's transmitted? How do we affect the water quality, which affects the parasite? And how do we affect the fish populations, which again affect the movement of the disease and the transmission cycle? And so I'm interested in how can we manipulate the natural environment in such a way that we suppress disease and we see less incidences of cancer. And again, this is very geographically specific to Southeast Asia and China and Korea and Taiwan. And now switching this and thinking of this, again, from my Christian perspective, with the natural environment, I tend to start at the very beginning in Genesis. And this is known in some circles as the creation care mandate in the Garden of Eden, the call to take care of the garden, and larger than that, the care to take care of the creation. And again, after the flood and the story of Noah, we see the covenant, not just between God and Noah, but between God and all living creatures of every kind on the earth, which speaks to this fact that when we talk about the covenant and about God's concern for the environment, we're talking about all living things. Now, shifting gears to our second type of environment I want to talk about the built environment, which to some of you may be a familiar concept, maybe not a familiar concept to others of you. But whereas I talked about the natural before, the built deals with what is man-made. So we're talking about how cities are made, how cities are planned. We're talking about infrastructure. In public health, which is my school, we talk a lot about walkability, bikeability. How does the design of our neighborhood encourage or discourage those kind of things? The way we use our land. And 2 areas of particular interest in public health lately are green space and food access. There's been a lot of research lately showing access to green space, like parks and natural areas, has a huge impact on children's mental health and consequently their physical health. And with food access, again, I think of the term food deserts, which is, again, another popular research topic of late, which deals with, can people access healthy food? I mean, they may have food and places to buy food in their communities, but is it good for their health? What are their options? Do they have access to produce and that kind of thing? And these are obviously tied into lots of variables, such as socioeconomic status and other aspects such as walkability. Now, for my first example of how this plays into health, these are maps showing walkability, which again is a metric usually dealing with can they walk to places they want to go, such as grocery stores, such as other people's houses. And on the left, we have a map of Berkeley, which many of us are familiar with. And you'll notice green indicating more walkable, red indicating less so. Most of the East Bay is pretty green, it's pretty walkable, other than the hill area, which more people may have cars, and so it's easier for them to drive places where they get access. Now, looking at the city of Atlanta, which is where I grew up, we see a couple neighborhoods downtown that are green, that are pretty walkable, but by and large, most of the city is very red. It's very dominated by very car-centric, and if you don't have a car, it's very hard to get around. There's a pretty poor public transit system, and again, the issue of food desert arises, access to produce, access to healthy food. Now, looking at the city of San Francisco, this is a map of parklets, which if you walked around the Mission or other neighborhoods, you'll notice a lot of these micro parks, which are basically converting small areas of land, usually parking spaces, to parks. And I'm using this as a proxy for green space. And you'll notice I've circled the Bayview Hunters Point neighborhood, which was mentioned in an earlier presentation today, and which is a fairly low-income, historically African-American neighborhood. And again, we see one parklet, and that parklet is actually attached to a cafe, which is a branch of another cafe in a trendier part of the city. And so we ask ourselves, what are the consequences of there not being as much green space in these areas? And again, are we getting stuck in cycles where, again, aspects of the built environment are reinforcing poor circumstances that cause poor qualities of life and health? Now, when I think of built environment in the Christian context and in the biblical context, I now shift to the other part of the Bible, to Revelation and these visions of the New Jerusalem and what the perfect city is. And I think of this as kind of a necessary urbanization, and there's prophecy ahead to the talk of the city. And then in Revelation, we see this lined out. The river of the water of life is clear as crystal, flowing from the throne of God. And again, for me, I got into this field because of my interest in water quality. I spent time on a missions experience in Ecuador, and it changed my perspective a lot. As I saw a lot of people with water-related disease, I saw this to be a major health issue of our time and in large parts of the world. And here we have a vision of clean water for all, which is a big goal for us, is a big issue in all fields related to water and a big goal for the future. Now, thinking to the third kind of environment, the spiritual environment, it's a little less tangible, a little less easy to define. So instead, I'm throwing up some questions. What does it mean to be spiritual? What does it mean to be religious? Now, in these days, in the fields, these definitions tend to be parsed apart. Spiritual, usually implying more like internal belief systems, religion, more like identifying the structures the communities we're a part of. And so with those parsed apart, obviously we think differently about how these affect health. Religion, again, meaning maybe more like community, how does that influence health? And then spiritual, meaning how do our beliefs dictate and affect the way we live our lives? And then two other questions, which are historically and presently very relevant. How do people of the same faith, religion interact? And again, we come to this issue and this idea of the unity of the body of Christ. And then how do people of different faiths, religions interact, which, again, presently and historically has underlined a lot of the conflict in the world, not just in the Middle East, but in all parts. And so when we think about spiritual environments, we think about how these issues arise, both within and between. Now, throwing up a couple of maps real quick, I show this map which shows religious adherence just as a percentage to show how heterogeneous this is across the US. We see some hotspots of religion, for example, in Utah because of Mormonism, across the Midwest, Pacific Northwest maybe a little less religious, in some parts of New England. Now, we think about other things. So this is a very famous map. You may not recognize it if you're not in public health, but this has to do with the obesity epidemic in the United States. Now this is back in 1985. We see most of the percentages, 14% or below. Fast forward to 2010, and we see a large part of the country, over 25%. This is a major, major public health issue, and it's caused all kind of crazy pseudoscience and weird communication about science. For example, we look at this next map about evangelical Protestants in the US, and perhaps it's real easy, and some people said, like, look, obese people, evangelical Protestant. And so, I mean, again, we know this is all logically false. We know that correlation does not imply causation, but still, it brings a lot of questions to bear. How do these tie into other social factors, cultural factors, socioeconomic status? There's a lot of issues that are brought up by these maps, and which spiritual and religious considerations tie into. Now, this is a diagram put out by a researcher at Stanford and a researcher at Berkeley, which charts some of the ways that spirituality and religion affect health, mostly for the positive. And some of the big concepts that are real popular is spiritual and religious support for coping with negative effects in our life. Social support. It is shown that social connectedness is really important to health conditions. Mental health, again, which trickles down to physical health. And even though these are mediated by other factors that I've mentioned, such as upbringing, socioeconomic status, all those kind of things, again, this is still very much tied up in the systems that are impacting our health, and it goes back to our spiritual and religious communities. And health is mentioned surprisingly few times in the Bible, considering what an important concept is, but it is still mentioned. And I just put some of these verses up to point out the fact that health, again, in Proverbs implies that following the Lord brings health to our bodies. And the second verses from Psalms and Jeremiah implies that it is in the Lord's will to withhold or give health to us. And then this very important verse from the Gospel that's very popular, Jesus answered them, "It is not the healthy who needs a doctor, but the sick," from Luke. And again, this challenges our paradigm of what we think health is, what we think about wellness, what we think it means, again, to be healthy. It brings up a lot of questions. And so, as I've kind of showed in this whirlwind tour, all these different types of environments and health are very much tied together. I mentioned, again, with Ebola, how these different environments affect the spread of Ebola. When I talked about the spiritual environment, I talked again about how that affects mental health, social connectedness, and how that trickles down to physical health conditions. And so again, it's a very complex intersection when we have a lot of different factors and variables at play. So just in conclusion, I want to throw out a couple of challenges for us. One, we must think of health holistically. Health is not just about the state of our physical bodies. It's very much tied also up into these concepts of social health and mental health, and they all connect and work together. Also, we must think of our environment holistically. We must understand that the environment is not only the outdoors, it's not only air pollution in the air, it is also how our cities are built, it is also our spiritual environments, how we take care of ourselves as spiritual individuals and in our religious communities. And this comes to my last point, which we must think of the Christian life holistically. And it's really easy for me to maybe extend this metaphor a little too far, and again go back to the idea of the body of Christ and the different members taking care of each other and supporting each other, and this idea that within ourselves, if we try to compartmentalize our faith, again, that's going to have impacts on our whole well-being. If we experience sickness in this one area and wellness in one area, they're going to affect the whole. And so as a final challenge, I just put down this verse said to Timothy, set an example for the believers in speech and conduct and love, in faith and in purity, being diligent in these matters and giving yourself wholly to them. I'm arguing for this holistic view of health environment as they interact with each other, and then extending that to how we think about our Christian life, both in relation to our health, in relation to our environment, and in the way we experience faith within ourselves. Thank you.